So I presume that person is being treated by a medical oncologist, and generally the higher grade tumours, and Dermot alluded to this, are more an area where we consider chemotherapy as opposed to some of these other sort of what we call oral medications, biologic medications, or the radionuclide treatments. Some of the chemotherapies can be oral, of course, as well as IV. So there's a actual small community of medical oncologists in the country, only around 30. We all have numerous meetings on gastrointestinal carcinomas, neuroendocrine being one of them. So a lot of us have very similar specialty interests and often see certain types of tumours, neuroendocrine being one of them. One of the initiatives of the NCCP is that all patients will be discussed at a national meeting, which will probably be based in Vincent's, but Galway, Cork will contribute, and patients from Letterkenny, from Carlow, wherever, will go through their network and be discussed at that. So while you may see or be treated in a smaller community hospital or wherever, the opinion will be coming from the regional centre or the national centre MDT. So obviously I can't speak for the specific individual, the specific case, but it may be that that person isn't just getting that opinion in isolation. I'm sure that patient has been discussed at a multidisciplinary meeting where there are surgeons, medical oncologists and other people. And as I said, soon it'll be a national MDT. So the person in Letterkenny will actually really be discussed in Dublin by all of us.
I just want to thank you, Greg, and I think that's a really valid thing. I mean, there are 8 centres now, cancer centres. We've got very good oncologists, but I would just add, and maybe just throwing the cat among the pigeons, if your dad wants to come to see us or anybody else, it's not that we're going to take that, your dad from that place that's treating the patient, but we can give an opinion. We can give an opinion. So if that is something that's required, we'll do that, and we'll do it in an appropriate way, and there's no problem with that. I think that's important to know as well, because we have to be able to also say, listen, Greg, I want your opinion, and I want my dad to see you, and they can go back to the other place, and I think that's important.
The other thing, just to add to that, is to echo that, but we have oncologists attend our meetings. So we have from Tala Hospital, we have Ray McDermott, who's in on our MDT every week. So the actual specialists, you are over from James's. So the Dublin MDT is across several, experts from several hospitals. So, but if you want to be clear that your relative or yourself has been discussed at the net MDT, either in Vincent's or when it kicks off in Cork or Galway, just ask the question directly, and if they haven't, then make sure that it happens, and it will happen.